Thank you all for joining us this afternoon. Today, we'll talk about addressing food and nutrition insecurity during the pandemic and beyond. Despite recent declines in food insecurity, despite the abundance of food across the country, both food and nutrition insecurity remain significant problems in the United States. Rates of obesity and high blood pressure are rising. Diet-related chronic conditions, heart disease, certain cancers, stroke, diabetes are now the leading causes of death. And the greatest disparities in food and nutrition insecurity are suffered disproportionately by Black, Latinx, and Native Americans, as well as people living in rural and lower income counties. Yet even during the pandemic, a number of significant steps have been taken to promote healthier eating patterns and racial equity. This session will focus on a variety of recent federal actions to strengthen food security, drive down hunger, and put a greater emphasis on the importance of nutrition as well as evidence of impact. Our discussion today will feature Sarah Bleich, a professor of public health policy at the Harvard Chan School of Public Health in the Department of Health Policy and Management. She's also the Carol K. Pforzheimer Professor at the Radcliffe Institute for Advanced Study and a member of the faculty at the Harvard Kennedy School of Government. Sarah's research, which has been featured widely in academic journals and national media, provides evidence to support policies to prevent obesity and diet-related diseases, particularly among high-risk populations. A signature theme throughout Sarah's work is an interest in asking simple, meaningful questions which can fill important knowledge gaps. She's currently working on various projects relating to COVID-19 food implications and the Supplemental Nutrition Assistance Program, or SNAP. Sarah served as a White House Fellow from 2015 to 16, where she worked as a senior policy advisor to the U.S. Department of Agriculture and the First Lady's Let's Move initiative. Sarah is joined by Erica Kenny, an assistant professor at the Harvard Chan School and its Department of Nutrition. Erica's work focuses on identifying successful, efficient, and cost-effective strategies to help improve children's healthy eating and physical activity behaviors and help young children form healthy habits for life. Taking a holistic approach to child health, Erica focuses not only on how schools and communities can support these behaviors, but also how experiencing weight stigmatization as a child in these settings can harm health, such as by increasing risk of disordered weight control behaviors and impairing academic achievement. Erica has recently mentored Harvard students studying obesity-related programs in schools, using evidence from both teachers and administrators. Currently, she and her research team are working on a qualitative study of how students experience weight stigma in real school settings and how obesity-related school programs can help or hurt. And now, without further ado, let's learn about addressing food and nutrition insecurity. Erica, the virtual floor is yours.
Great, thanks so much. And thanks so much for having us speak today. It's a real pleasure to be able to do this. Before we kick everything off and jump into sort of the substance of our talk today on food and nutrition security, I actually want to ask a couple of questions from Sarah about her current work. So folks might not know this, but Sarah is now at USDA in the Biden-Harris administration. And I would love to hear a little bit more about when you started with the Biden-Harris administration and what made you decide to do this.
Thanks, Erica, and thanks very much for the invitation to come today. So in terms of the current role, I began on inauguration, which was January 20th. And the day before, I got this big box in the mail with a computer and a printer and a cell phone, and very strict instructions to not turn anything on until 12:01 on Inauguration Day, which is when the new administration starts. And so for any of you who might be listening that know me, you would know that I am not very tech savvy. So it was both daunting to be starting a new job and then have to set up this whole home office remotely, but luckily there was a dedicated person to help me do it. And in terms of what happened right in the beginning, the meeting started almost immediately, and there's this total whirlwind of things popping on calendars and long to-do lists, and the need to cover many substantive areas since we weren't fully staffed up at that point, and we're still not fully staffed now in July. And so why did I decide to do it? Well, so I was in government the first time in the Obama administration. And I honestly thought that I wouldn't like it. I thought that government would be slow and bureaucratic, but I wanted to give it a try. And I was just blown away by the talent and the ability of the federal government to get stuff done. And there were so many people that I encountered who could make multiples of their salary elsewhere, but they had chosen to serve. And I can't think of a better place where you can make such a big difference in the everyday lives of people than federal government, because even the smallest things can have a really huge impact. So it was an honor and privilege to serve the first time, and I was really excited to have a chance to do it again with the current administration.
That's wonderful. That sounds so exciting. And so almost like a spy movie to think that you had all the stuff that you couldn't start until exactly 12:01. That's really cool. So can you tell us what's it like? Like, what's a day in your job like right now? And how does that kind of differ from your time in the Obama administration? What's kind of different about this time around?
Yeah, so in my current role, as you said, I'm the senior advisor for COVID, and I sit in the office of the secretary at USDA, which is US Department of Agriculture. And so as you're well aware, COVID is rapidly changing, and there's limited precedent in terms of how do you actually manage operations and make things change. So the days are very unpredictable. And so my typical day is filled with either I'm attending briefings or I'm giving briefings, or I'm constantly checking in with lawyers about various issues, or I'm writing memos. But in the Obama administration, I was also a senior advisor, also at USDA, but I was within a mission area. I was in the Food, Nutrition, and Consumer Services mission area. So my focus was very topical, and it drew on a lot of academic expertise that I had. It was also year 7 of an 8-year administration. So things were really predictable at this point, or at that point. And I probably should not admit this out loud, but for the first 3 days of the Biden-Harris administration, it was so hectic, but I didn't even have time to take a shower. You may remember that executive orders from the president were just flying around at a historic level, and those required a significant response, and some of them fell squarely in my area, which meant I was responsible for getting a whole lot of work done really fast. I would say that the constant theme in both the Obama administration and the Biden administration is just how much I enjoy working with the other career staffers, or civil servants as they're also known, and then also the political appointees. So the staffers remain or they can remain when an administration transitions from one president to another, but the political appointees turn over. There are about 4,000 political appointees, of which I'm one of in the federal government, and about 2 million civil servants. And their career staffers or civil servants bring all this tremendous historical knowledge and subject matter expertise. And the political appointees bring all this energy and enthusiasm, since our time is so limited. And frankly, it's just fun and exciting to work both on interesting policy, but with hugely talented people.
That sounds amazing to be able to have that impact too every day. So I'm guessing that there are some people listening who might like to get some experience in government. What kinds of skills do you think are most useful for people to develop if they want to be successful in sort of pursuing some kind of service work or career in government?
Yeah, that's a good question, because I think often the academic skills you might be getting may not totally suit you for a career in federal government. I would say the number one thing, if you're thinking about trying to get into federal government, is you've got to be a good communicator, both written and oral. There are times when I have 2 minutes to brief someone. So I have to get right to the point and be prepared to really clearly answer questions. And then so much information is communicated with memos, and writing them is a muscle you just have to learn how to flex. But the key is you have to be clear, you have to be concise, and you have to present the full picture. And I think this is where it's harder for academics, because we're so used to working narrowly on a given topic. And the issues that you're dealing with at the federal level both require fine detail, but also this broader perspective about where they fit in with respect to competing priorities and political considerations. The second thing I would say is you've got to be personable. My ability to get stuff done is directly related to how well I can either motivate people or get people to answer my calls. And the pace of government is super fast, especially at the start of an administration. And often you need an answer immediately to a question. But since the portfolios are so broad, you often have to reach out to a subject matter expert to get the answer. So you need people that are in your Rolodex who will pick up the phone and help you. I would say, particularly in the DC context, manners matter a lot, and you can get a long way by just being nice to people. I will tell you, my goal every time I meet someone is for them to say to themselves after the meeting, I want to talk to her again. And if I've made them feel that way, I think that I've done my job. I'd say the third thing is you've got to be flexible. I'm constantly jumping from one task to another based on the priorities of the department or of the White House. So you have to be flexible. And I sometimes like shake my head when I look at my current portfolio, because it's so different than my academic expertise, but it's all part of this broader mission, which I really like being a part of. In fact, I love working in the Harvard School of Public Health for the same reason I love working in federal government, is that it's great to be part of an organization where everyone is rowing toward the same North Star. And I would say the fourth key skill is you really got to have good judgment. So time is a precious commodity in federal government, especially when you're talking with senior leadership. And there are many very productive conversations that I've had over the last 6 or 7 months that have not lasted more than 5 minutes. And so to communicate that way, I think you have to hone two really important skills. One is that you have to understand that everything important is not urgent and prioritize as needed. And the second, but related point, is that you have to work on your signal to noise ratio. And what I mean by that is that in every field, and this is certainly the case in federal government, you're going to be bombarded with information. And so you have to decide what to focus on and when to do it. And it just takes time to figure that out. And the final thing I'll say is, at the end of the day, there are so many smart people like yourself that have pedigree, but I think it's the people that have superior people skills, judgment, and the ability to reprioritize as needed that seem to be most successful in leadership when it comes to federal government.
That absolutely makes sense. There's certainly some different skill sets than I think several of us in academia have in terms of getting a little deep in the weeds or tending to ramble a little bit. So that's really helpful, I think, for folks who are kind of thinking about switching from that kind of career to government, or just thinking about how to hone in on what skills are really necessary. That's really, really helpful. Thank you. All right, well, let's switch gears then and get into our topic of today about food and nutrition security. So, this is food security, and food insecurity is a term that's been kind of thrown around a lot. And, sometimes people get a little confused as to whether this means hunger or whether it's different from hunger. And nutrition security is definitely sort of a newer concept that has been floating around, I think, in sort of the research and policy realm. So can you get us all on the same page on what these are? So how would you define food security? How would you define nutrition security?
Yeah, great question. So food insecurity, the specific definition is a lack of reliable access to enough food for an active, healthy life. Some people use shorthand and call that hunger, but the specific definition is a lack of reliable access to enough food for an active or healthy life. It's a term that's been around for decades, and it's commonly used in research, it's commonly used in government. Nutrition security is a very new term, and as it's currently defined, it refers to having consistent access, availability, and affordability of foods and beverages that promote well-being and prevent disease, particularly among our nation's most socially disadvantaged populations. So the key distinction between these two terms is that nutrition security explicitly recognizes the need to promote well-being and prevent disease in terms of what people are eating and drinking.
Okay, great. So I guess one question I have too is, is nutrition security something we might think of that folks who have enough food but not enough healthy food could be experiencing?
Yeah, exactly. So someone could have enough access to calories, but it's the calories that they're eating that may increase their risk for diet-related diseases like obesity or hypertension or other things that are related to what they're eating. And that would mean that perhaps they have enough food to eat, but they are not nutrition secure because what they're eating is not helping them actually prevent disease and promote their well-being.
Great. I think that it's a really great concept for us to think about, because it is something, since chronic diseases impact most Americans at this point, it's really critical to be thinking about that, especially for the populations who also tend to be food insecure. So thinking about this and thinking about COVID specifically, what did COVID do to food security in the US? Can you give us sort of an overview of how COVID impacted food security and food insecurity?
Yeah, definitely. So you won't be surprised to hear that COVID greatly exacerbated food insecurity in the United States. So before the pandemic, and now I'm going to switch and I'm going to use a different term just so we can compare apples to apples. But before the pandemic started, about 4% of US households reported experiencing food insufficiency. Now, this is a narrower definition of food insecurity that refers to sometimes or often not having enough to eat in the past 12 months. And the reason we're using this term is that there was a survey that got stood up that allows us to look before and after the pandemic at how the rates have changed. And so in December of 2020, this measure of food insufficiency reached its peak of about 13.5%. And now it's a little bit below 10%. So it's declined quite a bit. It's still not at its pre-pandemic level, but it has declined. The other point, and Erica sort of alluded to this, is that the pandemic has really exacerbated long-standing disparities. And so in June, the most recent data suggests that the prevalence of food insufficiency, again, what that's referring to is sometimes or often not having enough to eat. It was about 3 times higher among Black and Latinx households compared to white households. Another way of saying that is that it's 1 in 5 Black households, 1 in 6 Latinx households reporting food insufficiency, but it's 1 in 15 white households. So these are big differences in terms of the impact of food insufficiency across different racial ethnic groups. We also know that food insufficiency is higher for households with children. So it's about 13% in households with children compared to closer to 8% amongst households with no children. So why do we care about all those numbers? Well, we know that if your eating patterns are suboptimal, that can contribute to rising rates of chronic disease, obesity, high blood pressure, and even premature death. So it is not just the fact that someone doesn't have enough food to eat. It is also the case that by not having enough food to eat, that is hurting both your short-term health and your long-term health. And food insufficiency or food insecurity both have effects beyond health on things like education and other things that could affect your well-being.
Absolutely. And are we seeing sort of things starting to get better potentially as COVID has started to recede, or have the data not really come in on that yet?
Yeah, so things are getting better. So the peak of the pandemic, the food insufficiency was at about 13.5%, and now it's at about a little bit less than 10%. So it is going down. It is still higher than the pre-pandemic levels, but the good news is that it is moving in the right direction. And I suspect at some point we'll talk about some of the ways that the programs that help feed people have been boosted and amplified to just help people that needed a little bit of an extra hand during the pandemic. And we can't know this definitively, but it's reasonable to expect that part of the decline that we're seeing is a reflection from sort of amplifying the social safety net when it comes to nutrition.
Well, speaking of that, that was going to go into my next question of what has been done, especially at USDA, to sort of try to strengthen food security during COVID and nutrition security.
Yeah, so USDA, for those of you who are not familiar with the department, has a suite of about 15 nutrition assistance programs, and the entire budget of USDA is about $155 billion. And the nutrition assistance programs account for about 2/3 of the budget. So it's a very significant piece of USDA's portfolio. And those 15 programs many of them are long-standing and touch millions, tens of millions of Americans. But when COVID hit, those programs, while important and have done a lot to help both address food insecurity and even health and well-being in some cases, they were not sufficient in their current form to meet the need of the moment that the pandemic had brought. And so there are a number of things that USDA did, in part with authorization from Congress, in order to make these programs more helpful to people during the pandemic. And that included a 15% increase in what are called SNAP benefits. That stands for Supplemental Nutrition Assistance Program, which reaches currently about 43 million Americans each month and helps them purchase food in about 240,000 authorized stores. That 15% increase will be in place through the end of the fiscal year, which is through September 2021. There was an increase in access to fruit and vegetables to $35 a month for each WIC participant. WIC is shorthand for saying Special Supplemental Nutrition Program for Women, Infants, and Children. As the name implies, it provides nutrition support for infants and for children up to the age of 5 and for their mothers. And the $35 a month for fruit and vegetables is significant because prior to that change, it had been $9 or $11 per month per person. A couple other key changes include extending free meals for children and through the 2021-2022 school year, and allowing higher reimbursement so schools can serve healthier meals. And in fact, there's a study that came out a few months ago by researchers at Tufts that found that children's healthiest meal of the day comes from school cafeterias. So being able to offer more free meals may have implications for children's well-being. And I'll mention 2 other key things. One is currently USDA has been tasked with revising what's called the Thrifty Food Plan. It's the basis for determining that SNAP benefit amount. And this is meant to allow it to better reflect the cost of a healthy basic diet because it's been a while since it was last updated. And the last thing that's happening is there was an increase in food purchasing power for low-income families with children through what are called pandemic EBT benefits. And so what this program did is it provided funds to families to buy food while schools were closed, because so many children get their meals through school, but when schools shut down, that avenue was no longer there. And so what pandemic EBT did is it was designed to fill that gap, and it would allow you to then use those benefits at an authorized store, like a grocery store, for example, where you could also use your SNAP benefit, and that made it possible for parents to buy food for their children.
It's a lot of different programs to sort of rapidly get out there and change what was going on. It's really amazing. So, through all of this, through all the as you mentioned the numbers on food insecurity before and during the pandemic, and how stark those disparities were by race, ethnicity, and also by sort of household structure. If you have a child in your household, it tends to be much worse. COVID, not just in food security, but across a whole range of health indicators and well-being indicators, has really sort of shown a spotlight on how deep health inequities are in the US. And do you think this could result in some changes to how nutrition assistance programs work? It's sort of in terms of incorporating and addressing health inequities, and if so, what changes do you think would be expected?
Yeah, it's a great question. And I'm going to be a little bit careful in my response here, because there's a lot that's happening that's under the hood right now. But what I can say is that when we take a step back and sort of ask what are some of the core priorities of the Biden-Harris administration, and then also of USDA, two key things are advancing racial equity and addressing nutrition security. And nutrition security is a core priority of Secretary Vilsack, who is the Secretary of the Department of Agriculture. So there is a huge amount of interest in thinking about, how can we amplify and modify the existing suite of programs to help them better address health equities. And what I can tell you concretely is that the last big stimulus bill to pass was the American Rescue Plan, and that was in March. And that provided USDA with a number of resources to help promote equity. And one of the key ones is one that I mentioned briefly, and that is increasing the value of the fruit and vegetable benefit through WIC. So what WIC received through the American Rescue Plan was an $880 million investment. And a piece of that, a large piece of it, is increasing that fruit and vegetable benefit. And again, that's going from $9 or $11 per person per month to $35 per person per month. So it's a big increase. And WIC, and there's a lot of research, and some of it's been done by Erica and many others, shows that WIC contributes to equity. I mean, its mission is to help low-income pregnant women, mothers, and children avoid undernutrition and enjoy better health. And there's ample research that suggests that WIC improves pregnancy, birth, and child health outcomes. So this expansion of access to fruit and vegetables for moms and babies is just one example of how a program change can potentially promote health equity. And I would say that in the coming months and years, it'll be important to be looking at lots of the different changes that are happening and then evaluating them to understand not only what has been the impact on the core metrics of food insecurity and more recently of nutrition security, but also what's happening to equity. And are we seeing things shift over time in a positive direction? So I have been in the hot seat for a while now, and I am going to put you in the hot seat, Erica, if you don't mind. Because I think people are going to want to hear about sort of the academic side of things, which is very clearly your lane. And as you all heard at the top, much of Erica's research focuses on how to promote healthy diets among children, particularly through nutrition policy. So Erica, can you talk to us about some of your research related to feeding children during COVID? What surprised you? What have you learned? What are some of the key takeaways?
Sure, I'd be happy to do that. It's been an interesting time to be a researcher in nutrition, for sure, and to be looking into how food impacts health and growth for children, and nutrition insecurity and food insecurity, because all of a sudden you're kind of chugging along assuming the world is going to go one way, and then boom, it's like a huge meteor hit for so many families. So it really has changed a lot. So my team and I have been doing a couple different studies during COVID. We've been very fortunate to be able to get to sort of dive into some of these things to try to help get some information that could be useful for policymakers in the future and for USDA in the future. One study that we have worked on, and that actually Sarah and I worked on a little bit before Sarah joined USDA, was to do a sort of deep dive among urban school food districts. So these are, school food service authorities that serve very large numbers of children, and particularly children who are more likely to be in poverty or near poverty, and trying to see what happened to their operations during this time when, during normal times, they sort of keep their operations humming along pretty well. But during COVID, all of a sudden they had to switch from, serving their meals inside a cafeteria and having this sort of very tightly organized system of taking in meal reimbursements for every meal that they serve, and then making sure that their operating costs go almost to the cent to what those meal reimbursements are. And all of a sudden they had to try to serve kids out in the community, and they had no idea how to do that. They're not set up to do that. They're set up to provide meals in school. They had no idea how to keep their staff safe during COVID, because as everybody remembers, at the beginning, it was do we wear a mask? Do we not wear a mask? Do we need to sanitize everything? What do we need to do to keep everybody safe? And they had to do a lot of changes they had a lot of impacts on their finances. So we did a study that tried to kind of combine some data on some sort of hard data or quantitative data on the school food finances from 12 districts, or 12 of the largest districts in the country, and combine that with some in-depth qualitative interviews where we actually got to talk to school food service administrators in these districts and really learn from them what happened and what their process was like, and trying to kind of identify, are there things that we can do that can support them better? If we think of COVID as this sort of almost like a stress test on the system, on the food assistance system, what kind of pressure points or sort of vulnerable points did it show? So can we shore things up for next time? So that study was really interesting because it was, I think the thing that was so surprising to me about it, above everything else, was just how much school food administrators, how passionate they were about feeding children and trying to keep them from going hungry, and also just how rarely they seem to get a chance to talk to people about what they do and to have their voices heard. And so I think one of the things that we really took away from it was that these folks really need to be involved in policy and decision making at all levels, because they have so much on the ground experience and they just have so much care and passion for what they do. But also just that, their sort of financial system, they're providing a crucial safety net service, but they're not really being kind of supported in that way. They have to basically operate like a restaurant. And so they were very vulnerable during the pandemic because they didn't have as many sort of customers coming in to take the meal. So that really, really impacted them. Another study that we're doing that's sort of related is kind of zooming out a little bit and looking at what the cost effectiveness of that kind of approach of having the schools kind of try to flip their operations to doing sort of community meal distribution. How did that compare to the pandemic EBT or PEBT program, where instead of having the food service operations prepare the meals and try and get them out to people, you just kind of get the cash value benefit of the meals onto a card and get it out to kids. And so we've been trying to kind of pull together all kinds of data, and I've been fortunate to get to collaborate with Jim Krieger at the University of Washington on this and his team to try to kind of see, can we see how they compared in terms of actually getting out to kids, how they compared in terms of getting benefits out to kids, and what the operating costs were for each one, to see, is there something that we really want to make sure we shift to the next time school is out for a long time, or there's another disaster or something like that.
Yeah, that makes good sense. And I think it's worth underlining for folks that are listening that COVID created all these opportunities for research, which were not always there. Many of them won't get pursued by the government. And so it's so critical that folks like Erica and others are asking all these important questions so that we can build up this arsenal of evidence that can be used to hopefully inform policy in preparation for the next pandemic. And so it's great that there's this research and a lot of other ongoing research to help answer a lot of these questions around, amongst these different policy changes, what seems to have worked best. And actually, that's a good lead in to the next question I want to ask you, which is, as you think about the waivers and programs that have been stood up to address hunger or food insecurity during the pandemic, and there have been hundreds, if not thousands, where are you seeing the most evidence of impact?
I think especially through the work that cost effectiveness project that I was talking about, it really became pretty clear that PEBT is just kind of a slam dunk of a program in terms of being able to make sure that you provide a quick safety net that gets out there and makes sure that kids are not going hungry. I mean, the tricky thing about PEBT that we found is that because it was sort of a new program, there was a little bit of a challenge at first in a lot of states in terms of rolling it out. And so those benefits didn't always get out to kids kind of very quickly, depending on the state, because they were trying to kind of pull these things together from scratch. They were trying to, some states had actually a lot of challenges identifying even who their free and reduced price meal eligible kids were, and finding out what their addresses were and trying to kind of make different parts of government talk to each other and different databases talk to each other. And it's a lot of challenging stuff to wade through. So I think hopefully, what we saw in terms of the impact of PEBT during the pandemic kind of provides some evidence that, keeping it sort of as a steady program, maybe even keeping it as a program during the summer when school is out, and not just a disaster program, but having something so that there's something in place so that it doesn't have to be quite so much work to start it up from scratch and get those things out quickly when a disaster hits. That would be, I think, the big thing moving forward. I think the other thing too, you mentioned the cash value voucher for WIC. We had another study that was sort of going on with talking to WIC moms, both current moms and moms who had recently left the program early, even though they were still eligible. And it was kind of interesting because then COVID happened in the middle. So we kind of got to talk to them a little bit about it. And we found that the cash value voucher was just so crucial for all these moms that we talked to. Like, it was so important to them. It was like their favorite part of the program. And they all talked about how that $11 ran out basically pretty quickly, no matter how much they budgeted. And so I think having that extra cash for these healthy fruits and vegetables, it's not just an impact on health that's been beneficial, but it's something that makes participating in WIC, which we know is this really beneficial program, it makes it more appealing for participants too, because they're able to kind of get this really, really tangible, great benefit where they can eat these delicious fruits and vegetables and feed them to their kids. And I think that was another thing that is really a huge benefit that came out of some of these programs.
Yeah, I think that's a great point. So from where you sit, keeping your research hat on, what are some of the key questions related to the intersection of COVID and nutrition policy that you think that we need to address in order to advance the science generally, but then also as we think about the implications around health equity?
Yeah, I think one of the key questions is just having some more research on what really happened. I think at the beginning of the pandemic, there was a lot of concern that this was going to increase childhood obesity rates among children because they were going to be at home and they weren't going to have access to school meals. And I think trying to understand how it really did actually impact children's diet quality and their obesity risk, and how that differed for higher income versus lower income, or Black and Latinx versus white kids, is going to be very important to kind of get a sense of moving forward. And I think in terms of sort of the nutrition policy piece, one of the things that was a concern for me personally because of the research that I've done in terms of health equity and COVID was, we were rushing to sort of make sure that everybody had benefits to make sure that they were food secure, but it kind of ended up, unfortunately, throwing some of the progress that we had maybe made with school meals and having these stronger school meal standards through the Healthy Hunger-Free Kids Act. Kids might not have had access to those specific meals that we know were so beneficial for their diets and were really helping, especially kids in poverty, reduce their obesity risk. And so I think trying to understand, did getting rid of, or not getting rid of, but having meals and food insecurity assistance that didn't necessarily adhere to those nutrition standards, what did that do for kids' health? And I think also just trying to see, like, what are some of the things that we saw during COVID that could continue on, like potentially universal school meals, or more summer meal program participation, which was a huge thing last summer too. So I think those are kind of the questions, especially that I'm interested in, and I think I hope are going to be important moving forward to kind of understand, which aspects are really going to be crucial to keep moving forward as we continue on with ensuring that we have like a really strong nutrition safety net.
Yeah, and I suspect that there are going to be dozens, if not hundreds, of dissertations focused on these very questions because A, they're super important, and B, like there's so much that we don't know, and so it's just ripe for investigation and discovery. And so maybe we can, before we open up to questions, maybe we can end on a more personal note for you, Erica, which is what advice? So some people listening may be thinking, I want to do an advanced degree in nutrition or nutrition policy or food science. And what advice do you have for people that are thinking about entering the field?
Sure. I mean, well, my advice would be to do it because we definitely need more people kind of working on these issues because it's a pretty, food insecurity, nutrition insecurity are pretty big problems that we're dealing with in the United States. There's no question about it. And they play such a strong role in the overall health and well-being of our population and in so many ways. So I think that, we definitely need as many minds as we can get sort of tackling these projects. I think, my advice would be to make sure you're sort of open to an interdisciplinary mindset. So, I love doing this because I get to combine my interest in nutrition with interest in social determinants of health and sociology and also policy. And I also get to do some community partnership work. And I try to kind of keep asking, why? So when we see inequities, why are we seeing them? Like what's that upstream factor that's kind of causing something downstream to happen? Like, can we go back and try and figure out, like, okay, why is this happening? Why are we having food insecurity? What are some of the policy levers that we can act on? But I think that, like being open to sort of a lot of different kinds of information and being able to learn from different fields, I think would be my biggest advice.
I totally agree. And I would say that I think one of the beauties of public health is that it attracts people from all different fields. And so almost by default, almost every project you work on, you have people that have different perspectives, which just makes the work better and more interesting and probably better able to answer whatever the question is at hand.
Absolutely.
So now it's your turn as audience members to ask us questions.
Great. And Sarah and Erica, thank you very much for doing this. And I'm going to bring you some of the questions that our attendees are providing through the Q&A, which we can still do. It's also a place where you can upvote questions that have been provided. I'm going to start with a nice big broad one. What are the most important steps to take to improve nutrition in the US? Go. Right. So just thinking particularly about nutrition, and I'm going to say that part of what we've been hearing is a lot about food sufficiency and food security, but not necessarily whether there are any trade-offs between food security and nutrition security. Like it's automatically assumed that if you have one, you have the other, and maybe that's not so the case. So if you could focus on nutrition for the moment, what are the most important things that can be done in the coming years?
Do you want to go first, Eric, or should I?
No, I think you can go first on that one.
So I would say it's a great question. It's a great question, and it's a hard question because it doesn't have this one simple answer. But as you think about people eating, our core questions are, do they have enough resources? Do they have financial access to the food that they want to be able to purchase? Or I'm sorry, do they have financial resource? Do they have physical access to the food that they want to purchase? Do they have the skills needed to prepare the food in a way that is healthy? And so it's this combination of financial access, of personal skills, but all of this really, it boils down to, what does someone's environment look like? And it would be insufficient if we just said, well, we're going to put healthy grocery stores in everyone's neighborhood, but we're not going to actually make the prices at an appropriate price point that are going to make healthy foods competitive, or we're not going to help people learn how to cook healthy who don't already know it. And so there's this constellation of factors that have to work together in order to promote healthy diets. And the challenge is that rather than having all of these easy ways to do it, essentially the way our food environment is set up is that there are all these barriers which make it hard for us to eat healthy. So the fact that highly processed food is cheaper and more convenient, and it often takes a lot more time to cook from scratch and so on. And so part of the goal of promoting healthy eating is to think about what are all the different ways, both at the individual level, but more importantly at the broader environmental level, that you can bring down all these barriers that make it hard for someone to follow a healthy diet. What else, Erica?
No, I 100% agree with all that. I think it's really something that starts, like I was saying, with those upstream factors and thinking about what does our food system look like, and what's healthy, what's not, but what's affordable and what's not. And I think also thinking about meeting people where they are in terms of what they're able to do with food preparation is a really key thing. And, that things like ultra processed foods are not just less expensive, they have a much lower time cost associated with preparing them. And I will say that, I think before actually I became a working mom myself, I was like, oh, we just need to teach everybody how to cook healthy, and that's going to solve the problem. And it's definitely a part of it. I mean, a huge important part. We definitely need to increase food literacy and cooking skills, but at the same time, if you're a working parent, and I'm somebody who's super privileged and has it really easy among working parents, but still by the end of the day, like, I'm pretty tired, and it's a challenge sometimes to get a meal cooked from start to finish and put on the table for my kids. So I think, being more sympathetic to those real challenges that people face in terms of being able to get that food on the table and get that healthy food on the table, and thinking about how can we really meet people where they are and help them.
And just another point, so then one way to make this possible then obviously is through policy. So we talked about a whole bunch of different policies, and hopefully what you heard through all of them is that they are not meant just to be increases, they are meant to be meaningful increases. So the fact that the WIC fruit and vegetable voucher went from $9 or $11 to $35 is a change, and it's a meaningful change that will probably affect both people's ability, obviously, to purchase fruit and vegetables, but maybe even increase participation in the program. And just another example is SNAP participation, or the SNAP benefit, increasing the overall benefit by 15%, which is about $100 per month for a family of 4, is significant. And that has the ability to really help people make meaningful changes. Because if you just give people a few dollars, it doesn't meet them where they are, and it doesn't actually give them the tools they need to make the changes that you're trying to drive towards.
Well, it's fair, but I'll start this with Erica next. You're touching on at least one of the potential problems there, which is it's all very well to be able to buy more spinach, but my kid won't eat spinach at gunpoint. So what do we do now with, or to phrase it in the questions here, are there federal or state programs that you folks have seen that really work to address some of the lifestyle issues? How do you prepare green vegetables that my kid will eat? What do you do if you don't have consistent access to elaborate kitchen equipment, et cetera? Have you seen programs that get at that part of the behavior and preparation?
Yeah, I haven't, in terms of things at the federal level, there's certainly some resources through WIC, actually in particular, that help sort of, WIC has a whole, we talked about the food benefits aspect of it today, but WIC provides a whole range of additional services to the parents and the families who participate in it, in terms of nutrition education and breastfeeding support and a whole host of issues. So they have definitely run some pretty innovative and successful programs in terms of trying to help with that. And then I think this is definitely an area too where you see like a little bit more in terms of sort of community organizations who can pop up with, it's having some cooking classes or things like that that are really tailored to sort of specific communities and environments so that it's something that works for the people who live in the community. But I think, and there's certainly at Harvard, we actually have a really wonderful program called Teaching Kitchens, which is doing a lot of work to try to actually educate physicians about proper nutrition and cooking skills. And it's a partnership with the Culinary Institute of America. And I think there's definitely a lot of work there, but it still is this issue of like, if we have to also solve that access issue and making it fit into people's lives issue first. And picky eating is a challenge for people. I mean, especially for low income families, like it's pretty painful to buy expensive fruits and vegetables and then feel like you have to throw them out because your child's not eating them and to have to waste that. So that is absolutely a challenge. And I think there are a ton of researchers trying to figure out what to do about that as well, in terms of trying to, help kids try new flavors.
And I would just add on to that just in terms of federal resources, another program is SNAP Education, which is one of the largest ways that nutrition education is delivered through nutrition assistance programs. It's a small piece of the overall SNAP budget, but it tries to do a lot to basically help people identify recipes that are consistent with the benefits of the program, to not just make recipes generally, but to try to make them more culturally specific. And so there's a lot of different ways that program is trying to help people make healthier choices. But I would say we have to be careful when we think about what we're trying to get kids to eat. And this goes back to Erica's point about meeting them where they are. For a kid to be healthy, they don't have to eat spinach if they hate it. We just want them to be eating vegetables of some sort. And they could be fresh, they could be frozen, they could be canned. And so I think there's sometimes some stigma associated with people eating canned or frozen vegetables, and they don't have to be unhealthy. So I think it's figuring out if perishability is the thing that really has people concerned, then what you have to do is work with them to say, all right, well, how are we going to do this with canned vegetables? How are we going to do this with frozen vegetables? And with kids, like, you have to introduce things a few times often to get them to like it. And so by giving families more resources, you are freeing them up a little bit to try to get things into their kids' mouths that they might otherwise completely ignore because it just doesn't make sense financially.
Very helpful. This gets to a question we just asked about nutrition education, nutrition literacy, that these programs are more than just providing access to food, but also what to do with it once you access it. Let's expand the population, but we've been talking obviously a lot about families and children, but what about housebound older adults? What about people in rural areas that don't have, Meals on Wheels down their block? What has been done? What can be done?
So I could start with that question. So the bigger programs, bigger really with respect to USDA is really talking about SNAP, school meals, and WIC. Those are the three really huge ones. And when we think about older adults, there are some specific programs that target them, but there also are many older adults that participate in SNAP. And so if you are an older adult, you can take those benefits. And we should have said this earlier on, but when you're using a SNAP benefit, it's effectively an ATM card. And you're going into the grocery store and you're buying things that are authorized, which is pretty much anything in the store, except for hot prepared food and things like toilet paper and cigarettes and alcohol. So if you are bringing up your basket and you have some things in your basket that don't qualify, let's say you have a pack of cigarettes or some beer, basically they'll say, okay, you owe us this amount of money for the SNAP authorized, you swipe your card, and then you owe us this amount of money for stuff that doesn't qualify. But it's a very seamless process. And so it's very easy, is my point, to use these benefits. And so if you are an older adult and you qualify from an income perspective, then you could receive SNAP benefits. One thing that happened during the pandemic in response to people getting access to food was that there was a rapid expansion of SNAP Online. So prior to the pandemic, 8 states were allowing people to use their benefits online, meaning you could go to, say, Walmart.com, for example, and order vegetables and whatever you wanted to order, as opposed to going into the store. that has rapidly expanded. And I think now it's 47 states in the District of Columbia, and the number of retailers has greatly expanded. So that makes it easier for people who live in areas that have limited resources to get access to healthier foods via the online system. Now, that doesn't totally address the problem in rural areas where delivery can be an issue, but there's a lot of efforts in rural areas to try to get healthier foods in front of people. And so I would say where there are gaps, there is a concerted effort to figure out, well, how do we fill them? And how do we help people make different choices based on their environment? And I think if that's one of the messages we want to leave you with, is that policies and programs that are ignorant or tone deaf to how people really live are not that effective. You have to sort of say, well, what does your environment look like? What are your needs? And how do we help you in either real time or short time try to address those? What else, Erica? What would you add?
I don't think I'd add anything. I mean, I think I'm glad that the question was asked, because I think that it is, especially as someone who does focus almost all her work on children, there is so much need and so much still of an issue with older adults. And I think that it's really important to keep those folks in mind, especially as some of these technological changes happen to the programs that might be leaving some folks behind a little bit. But it's definitely an underappreciated issue in terms of how much food insecurity can continue to sort of impact, or poor nutrition can continue to impact older adults as they age and play a role in a lot of different chronic disease, or worsening their existing chronic disease conditions.
This then raises the question, which a couple of our attendees have raised: what can we do as putting aside, and we're going to get back to this in a second, putting aside those who want to get into the field as young professionals, how can we help? Is it donating to food banks? Is it being part of particular programs? In Massachusetts, but even nationally and internationally, how can people help those who face food and nutrition insecurity? Erica, I'll start with you.
Sure. I mean, I think definitely donating money and support to food banks and food pantries, donating your time, asking them, maybe before doing a can drive, asking your local food bank or pantry what they need is a really great thing. There are a lot of community organizations who can help if you want to get sort of hands-on experience helping folks, but definitely, ask what they need first. And a lot of times it can just be cash. But I think that's certainly a key thing to do. I think in terms of, helping folks access some of these other programs, potentially just, talking to folks about them and talking to your friends and neighbors about them, maybe to reduce some of the stigma that goes on about these programs. Because one of the things that we didn't really talk about today that's a bit of a shame is that there are a lot of people who will qualify for something like SNAP or WIC or school meals, and they won't get on it because they hear a lot of the messaging around you're a drain on resources or tax dollars or something like that. And people don't want to do that. They don't want to feel like they're, or they feel like, oh, I'm going to take this away from someone else and I don't need it that badly and things like that. So I think that also kind of, talking to people about how beneficial these programs really are. And if you have a child in school and getting involved with your kids' school meals and having your child, try out the school meals if they're not doing that right now, can also be a way to kind of get a little bit more involved in these food programs too, and help kind of raise their profile a little bit. And Sarah?
Yeah, and I would say that to add on to that is, if you think you're interested in going into this field, go out and volunteer, because it's one thing to read about it and to try to understand the challenges. It's another thing to go to a food bank or a food pantry and just see how it happens, to see both how the food is packaged, to see how people are served. Because what I suspect will happen is that a lot of things will surprise you. I remember as a child volunteering as a group in Baltimore City, and they took us on this little training, a 5-minute training beforehand. And they said, one of the things that you're going to notice is a lot of people don't finish their plate, and you are not allowed to judge people because they don't finish their plate. And so for me, the take home point, that was 30 years ago. The take home point is that anytime you're dealing with people that need an extra hand, you have to think about, how do you do it with dignity? Because it's hard to ask for help. And so in thinking about how do you have a meaningful role in the field, how do you contribute, you have to really understand the problems, not just in terms of people needing food, but what are they struggling with in the quest to find that food. And I think if you have a better handle on that, you can be more effective in your ability to help and to guide the conversation where it needs to go.
This leads us very nicely into what will have to be, unfortunately, last question. I'll start with Erica, then turn to Sarah. How did you get into this field, and what advice would you give for those who want to follow in your footsteps? Erica, for you.
Sure. So I got into this field in a very circuitous route. So I actually started my kind of journey towards having a career thinking that I was going to be a classroom teacher. And that's what I kind of went to college for. And when I was doing some of my student teaching work and volunteering work, I really started to notice that I was getting almost more bothered by the fact that my kids or the students I was working with were coming in without having had breakfast, or like having like really, like a bag of chips or something for breakfast, because that's what they were able to kind of grab on the way. And noticing that at the time, this was prior to the Healthy Hunger Free Kids Act, you'd go in and the smell of the school meals would just kind of like knock you out, and nobody wanted to eat them and things like that. And I just kind of got more concerned. I guess for me, it hit home a little bit. My dad's a physician, so I was a little bit more primed, I think, to think about health. So I kind of went in a little bit of a circuitous route and ended up, thinking about, maybe public health is this way that I can kind of combine some of my interests in food and in education and in civil rights, and kind of try to combine those somehow. And so that's what I ended up doing, and found that it really was this way that I could get to do all these things. And I was very lucky to work at the Red Center for Food Policy and Obesity. So I was able to kind of dive right in on doing some of this really interdisciplinary work. And I think my advice would be to be open to different things. And, it's public health can sometimes, and nutrition research can sometimes be a little bit non-traditional. So it's okay if you don't know exactly what you want to do at first. And it's okay to kind of try volunteering somewhere or doing something else to get a sense of what you really like and take that time.
I always love hearing. I knew like 50% of that, Erica. So in my case, I was pre-med, like I'm guessing many people in public health are. And then the idea of like one patient at a time, I was like, it's not me. Like I'm too impatient. I want to deal with broader policy changes, but I didn't know anything about public health. And so I ended up learning about public health and moving into a doctoral program. And what I can say is the thing that gravitated me toward the field is I wanted something that was practical and real world, and you could use research to actually drive policies, as opposed to research for the sake of research, which I'll admit to being a little bit allergic to. And then the question of, well, then why within that, why food and nutrition, is when I did my doctoral training at Harvard, and I had to pick a dissertation topic. And one of the things that has always motivated me a lot has been my family. And one of my grandfathers was a radiologist in New York City, and the other one was a corn farmer in Maryland who couldn't read or write very well. And so when I got into Harvard for grad school, it was a huge deal for my grandfather, who was a corn farmer. And I remember I had been living in LA and was driving back to Maryland to see him, and then up to Boston to start grad school. And he pulled me aside and he said, Sarah, he said, don't go up there, meaning up to Boston, and get uppity. And I thought, okay, whatever. But then a few years go by, and it's now time for me to pick a topic. And I started thinking about what he said. And I wanted something that an average person can understand, where you didn't require a fancy degree, because frankly, so much of health policy is full of jargon and it's really hard to understand. But food and nutrition is not that. You can be someone who's got very little higher education, and you can have a very interesting conversation about it, because it's about how we live our everyday lives. And so for me, it is a topic that I have loved for so long, and I've never looked back. And I'd say, in terms of my advice to all of you, is find your passion. And all of you have it somewhere. For some of us, it takes a little bit longer to find. But once you find it, it's the thing that gets you out of bed in the morning, and it makes you effective, and it makes the work fun. And so find your passion and follow it.
Very good. Well, thank you, Sarah and Erica, for being so passionate. And thanks to all of you who have joined us today. We hope you'll join us for our signature event next Wednesday, July 21st, to talk about the transformative power of civic engagement. Information on upcoming events, as well as recordings of past ones, can be found at vpal.harvard.edu/vpal-events. Good night, everyone, and thank you for being part of the conversation.